Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome back to DocTalk. I'm Brent Leavitt, your host, and owner and proprietor of Battleborn Financial Advisor and Health Insurance Brokerage. Again, we're here today with wonderful primary care doctors here in Pahrump. And we actually have a special treat today because we have a brand new primary care practice here. It's actually called Silver State Health. And we have Troy Perkins, who's actually a nurse practitioner. Make sure you know he's not an actual MD, but he is a nurse practitioner, which is actually a phenomenal thing. And we'll talk about it a little bit more in the episode about why it is wonderful. And we also have the practice manager here. We got a threesome here of Doug Self. I didn't want to say your name wrong, but Doug Self. And Silver State Health, they have a website, silverstatehealth.org. And they are actually a grantee, I believe. You said a federal grantee. And you're here to help with a lot of all different income populations, which means that you guys actually work a lot with Medicaid, Original Medicare. You also have the ability to do a lot of self-pay cash patients, and you have a sliding scale copay based on income and need. So a lot of people, they're worried about maybe I don't have insurance, or maybe my insurance is lacking, and you're worried about maybe can I afford to go be able to get a health assessment and even a mental health assessment, which is something phenomenal about Silver State Health. And they have the resource and ability to do that. If you're wondering where they're located, they're off of Calvada, not too far from Pahrump Valley Boulevard there. And it's hard to miss their sign. It says Silver State Health right in the front. And it's a wonderful resource that we have here in Pahrump. And it's brand new. And since they're brand new, you can even get to see them same day, next day, within a few days. They'll get to see you quickly. In fact, somebody posted recently on Facebook, we're looking for a mental health provider. They get a mental health assessment, things like that. And I said, you need to go see these guys at Silver State Health. They're phenomenal what they do here, and you want to make sure you see them. Unfortunately, they're in the process of getting contracts with some of our insurance providers here. They do have some commercial insurances, such as like United Healthcare and some of the Blue Cross Blue Shield stuff, but they're in the process. And they also take Ambetter, which is one of our exchange products that we have here as well. And if you have questions about that in your health insurance, please call my office. You have the phone number right there, the 764-2252 number. And if you go on our website even, you can make an appointment with us and be able to get a time to see us even virtually or in person to get an appointment to talk about your insurance needs and also find out, hey, I need to see Silver State Health, and make sure you're seeing them and getting the needs you have. So I want to talk to you guys, get a really cool intro. Tell us about who you are at Silver State Health. I'm going to actually make Doug, because you're kind of the practice manager, just tell about who Silver State Health is, what your goals are, why you came Pahrump. Tell us a little bit about that.
Yeah, so we were founded in 2017. As everybody's aware, there's a huge need for healthcare, both in Las Vegas and Pahrump. We have an area overall that does not have enough providers for our populations. And specifically, we wanted to try and help those folks, both in the rural setting and the urban setting, that do have difficulty finding providers and sometimes paying for those providers. And so, as you mentioned, we do have a sliding fee scale based on their income level. And that can start as little as $30 to see Troy for either a primary care assessment or for a mental health assessment. And like I said, it varies on your income level if you don't have commercial insurance or Medicaid or Medicare.
And Troy, tell us about, interest you is the leeway to you is like who you are, what you kind of practice in, and what's so special about Silver State Health. You're right now you're interning a little bit for mental health, and you're going to be a full-fledged in the psychiatry stuff in a while. But talk about that.
So originally I'm from Ohio. I did live in Las Vegas in the 90s. Came back here, was recruited back just because of their mission and what they do. In Ohio, I did take care of underserved populations, people with financial difficulty, so I look forward to that. But I am a primary care family practice nurse practitioner. I've been in training for my certification for mental health for the last 2 years. That will come to an end here in December when I'm done, but I currently work with Dr. Linden, who is in Las Vegas and a part of Silver State, and excellent psychiatrist, so I've had great training under him. And so we do see family practice, family medicine, and we do psychiatry at the current time.
And a lot of people, that's the biggest thing. Mental health is the biggest, I think we miss here in Pahrump, is getting the ability to do it. Your primary care doctor, a lot of times, they can do mental health stuff, but very limited in scope. Your scope is a lot less limited. It's more kind of, you can even do a step above even what those primary care doctors do here in town. And you can do a lot more in depth, and you can actually prescribe a lot of the medications that the other doctors really can't. Is that true?
That is true, and that is one of the things and one of the reasons why I went back into psychiatry, is because a lot of times in family medicine, a patient comes in and they have needs, whether it's anxiety, depression, with everything that goes on in this world, it's not uncommon to have some anxiety, depression, post-traumatic stress disorder, anything like that. So we can accommodate those patients, but that was one of the main reasons why I decided to go back, was so when a patient came and saw me, they could get the whole experience and feel comfortable seeing me with their primary care and their mental health needs.
And Brent, I would also say that one of Silver State's main goals is to treat not just the physical body and primary care, but it's also to help the mind as well. And from a board level, from a leadership level, we realize how important mental health is. And that is something we really, really want to focus strongly on, is mental health, physical health, and why we feel like we were very blessed to end up to be able to find Troy and then offer those services here in Pahrump.
Yeah, so wonderful resource. So I'm going to just reiterate the fact that, I know that right now people are stuck in their homes and they're getting depressed and things, life is not the best right now. And you're thinking about the fact that we just got word just when we're recording this, just yesterday we got word that the governor's pulling back some of the phases because we were seeing an uptick in cases and things and hospitalizations in Vegas. And it's making us think, man, we're going to be stuck in our houses for another whole year. I'm not feeling very happy. Yeah. Could there be some unintended consequences with regards to suicides and even anxiety, depression, things like that? And we're afraid to see our primary care doctor, maybe because we're thinking they can't really help us. Maybe there's some barriers you have maybe financially, you're thinking I don't have any money because maybe I have unemployment coming through, maybe I just lost my job. You can use them as a resource and call Silver State Health and say, hey, I need to see somebody and I need to talk to you, especially that understands my situation. And maybe it's not necessarily mean we're going to give you a medication because of it. It could be something else totally. It would just maybe you need to be able to work through some mental stuff and just understand that, hey, maybe you can take care of it, maybe some of your diet, or maybe it's something else you're doing, and maybe it's an underlying health condition you didn't realize you didn't have as well. Another thing we can do is, I always mention too, maybe you're out of work right now, you have a qualifying life event. You can even get insurance that's affordable. You're thinking maybe it's not affordable, but through Nevada Health Link and some of the subsidies, you can get a plan that's affordable for you. A lot of people forget that, and they can call my office and we can help them get at least some quotes and some numbers on you, find out what it is. And Silver State Health, if you're worried about costs, they'll even work with you financially and getting a copay that you can afford. That way you're not stuck with, man, I've got to see Troy and he's going to cost me an arm and a leg and I can't afford that. I got to put food on my table. I got to feed my kids. But don't make your mental health and your life dwindle because of that. You got to make sure that you're working with them.
And I would add, Brent, a couple things to some of that. We traditionally do want to see the new patients face-to-face the first time. We do understand a lot of folks' reservations sometimes about going out to see a doctor or going out to see this. So once we see a patient for the first time in person, we do have the option of telehealth and treating and taking care of the patient that way as well. And as you did mention, we are seeing a variety of mental health care needs because we're seeing a lot of folks that have lost their job. We're seeing, as you mentioned, the folks having to stay at home with the families, which can be stressful in a variety of needs. And then also we're seeing children whose social lives have been dramatically disrupted right now with school and all that kind of stuff. So it is a very large need right now.
Yeah. And also in the fact that, when you walk in the building, people are thinking, oh, what's this going to look like? I went myself and was like, it's very super clean. I think everything's pretty much white. And you walk in there, super clean. You walk in there, you notice that you're gonna, everybody's masked and everything. Worried about that. Am I gonna catch a virus? Things like that. Is knowing that it's super clean. They're gonna see you, and it's a very personable office space where you don't feel like you're. In fact, their office, in my opinion, just felt like it was a little different than a lot of doctors' offices, where you didn't feel like necessarily a doctor's office. It felt more like a comfortable space to sit in and just be able to talk and get to know Troy and find out what's going on with your situation. Yeah. Besides mental health, what other kind of stuff do you see, Troy, that you see coming in your doors, or what kind of things that you mentioned underserved population? What are they really being underserved for, and what other things are?
A lot of people just avoid even preventative medicine. They don't want to come in and they're like, oh, I'm healthy, I'm not having any issues, but don't realize all of the things that they need when they reach a certain age, whether it's colonoscopies, mammograms, things like that. But I see a variety of patients between high blood pressure, diabetes, all those things, and including preventative medicine, keeping you healthy.
Do you guys do any labs there at the office? Do you send them out? How do you guys deal with that kind of stuff?
We are in the process of trying to set up our own lab, but currently we do use the local labs that are available between Quest and LabCorp, which we have a LabCorp right there at our office. So a lot of times our patients will leave and go either straight to LabCorp or Quest.
It's a nice little walking distance there to LabCorp.
It is. Yeah, it's perfect. Get part of that 30 minutes of exercise 5 times a week. Yes.
Especially worried about diabetes or something like that. Maybe, hey, just exercise and diet, right?
Exactly.
Yeah. What other kind of stuff, besides just getting the preventative care, are there situations such as, I know we mentioned, I think we talked privately before too, we don't want to talk about it, like football, like addiction stuff. We get a lot of people that happen, you deal with that and you understand that a little bit more, so is that correct?
Yes. Having a background in addiction medicine, it does help. A lot of people out there don't want to come and see a primary care because maybe they're currently experiencing some addiction in that. Because I have a background in that, that special population should not be afraid to come and get care and to tell and talk about their addiction. That is completely something that needs to be talked about and needs help. And I want patients to know that anybody that comes and sees me can openly tell me that. I think that being able to do family medicine and take care of their mental health needs, and also that addiction medicine part, that background, I think patients become comfortable being able to, I don't want to call it one-stop shopping, but being able to come to, it doesn't make me any better than any other provider, but it's more convenient sometimes for a patient to be able to come in and develop that relationship and talk about something that's so personable to them, or a family member. So.
Yeah, so don't let it slide. Don't think maybe don't think that even if I have a small addiction, maybe you think it is a problem. You can see him and he'll take care of you and make sure that you're understanding what your situation is and find the right tools for you. We're going to go to break in a second here, and we'll reconvene, and we'll talk a little bit more about this brand new practice here in town, Silver State Health, silverstatehealth.org, and we'll be back in a minute.
We will return with more Doc Talk after these messages. Welcome to Doc Talk with your host, Brent Leavitt. And Doc Talk with Brent is sponsored by Battleborn Financial.
Welcome back to Doc Talk. This is Brent Leavitt. I'm the owner and proprietor of Battleborn Financial. We're continuing our conversation here with Silver State Health with Troy Perkins, our nurse practitioner, and also we get the practice manager, Doug Self, here from Silver State Health. We got the corporate guys coming up from Vegas to see us. But this is such a wonderful experience we've been having. I just want to reiterate a little bit. We've talked to this group, Silver State Health, we tell a lot about we're going to talk more about not turning anybody away. But I want to focus on the fact that right now, financially, people are a little bit worried about ups and downs in income. Maybe you're losing your job. I want to make sure you understand that health insurance is definitely something that is affordable to you and available to you. If you've lost your job in the last 60 days or lost insurance coverage, you can still call our office and we can get you insured through Nevada Health Link, getting you the stuff that you need. In fact, our office, Battleborn Financial, just got awarded the grant again from the state to make sure we're helping people enroll in Health Link coverage, make sure you're getting affordable care. And you'll find that people are worried about the fact that they're paying a lot for insurance and the deductible's like $1 billion, whatever it is. You're like, why am I paying for insurance? Well, you'll find that based on your income, you might even find an insurance policy that it's super affordable and your deductibles and stuff are super affordable as well. And even if the case you're thinking, man, that $7,000 deductible, I'll tell you what, to having something is better than nothing. And if something catastrophic happens to you, I want to know that you're covered and taken care of. If you were to get hospitalized because of COVID stuff, every single insurance carrier that I know of is waiving copays and deductibles for all the COVID-related illnesses and sicknesses right now. And so you can see your practitioner and be able to take care of them. Right now, Silver State Health, they're taking Ambetter patients through the exchange. They're more than willing to work with any other contracts you have. So if you have insurance or a job and you're like, man, do you take that coverage? They will work with you and getting that coverage and maybe work on getting contracted so they can see and continue to see Troy and making sure you're taken care of and what you're doing. So I want to talk, I'm going to take it to Doug here. He was talking a little bit about what we were saying before about what you guys see and how you don't turn people away.
Yeah, we are very, very passionate about treating all people, regardless. We hope that you can get insurance and afford it, but we do realize that not everybody can afford insurance and not everybody can get insurance, and we have a passion for that. You mentioned you having a state grant. We actually have a federal grant to help us help those folks who don't have insurance as well. So in the last segment we talked about, we have a sliding fee scale based on income level that goes from $30. The maximum that someone would pay would be $120. But we are definitely willing to work with people on their financial needs, and we won't turn people away based upon financial issues and problems. We just won't. And so many times what they'll do is they'll submit maybe tax return information or maybe layoff notification. And there are instances where we will completely waive, i.e. no charge for a patient. Or let's say the $30 is really hard. Maybe we'll set up a payment plan for $5 a month or something like that. But our biggest concern are people's health, people's physical health and mental health. And so, yeah, we do not want financial considerations to get in the way of health.
Yep. And I know we mentioned that in town I always see people coming and going, especially in the mental health space. I've seen like at least 5 or 6 close up shop after coming to town saying, oh, we're going to be here. And then it's like, we're stuck, what do we do? And now we got to go to Vegas, or what's going on with this? And we were talking about the fact that you guys are here to stay. And not only are you here to stay, but contractually and everything like that, is you guys are committed to this place, and you're gonna be like, hey, we're gonna stay here, and we're gonna make this our home, our community, and we're gonna be dedicated to Pahrump and what we're doing.
Yeah.
Right?
Yeah, so right now we are what's termed a federally qualified health center. And there are over 5,000 federally qualified health center sites in the United States. And just as we have an approved site in Las Vegas, we have an approved site in Pahrump. And that site, our site in Pahrump, is just important in the federal eyes as our site in Las Vegas. So yes, we are definitely here for the long term.
Yeah, and you guys get a lot of support from the Vegas people as well. You mentioned you work with the actual psychiatrist in Vegas and stuff like that, and have that wonderful support there. But you actually are here, you said 4 days a week, I believe, right?
We're actually here 5 days.
5 days a week. I was way off on that.
Yeah.
So,
and currently doing Saturdays. So that's a huge convenience for patients who, hopefully schools get back in session, and people work Monday through Friday sometimes. That's their schedule. So to be able to see patients on Saturdays.
And nobody does Saturdays really. I mean, that's phenomenal. And you can they get like the same day of like kind of semi-urgent kind of matter on a Saturday? Or?
We don't do that currently. It is in the talks about that, but currently it is by appointment only, usually at least by Friday. But that is something that we're talking about because we always want to better our services.
Do you guys have access? Can they make appointments online, or is it all everything by phone? How do you make appointments with you
Everything
guys?
currently is by phone right now. Yes.
Yeah, put their phone number up there again. They do have a website, silverstatehealth.org, but you call in to make appointments because they want to make sure that they're booking you in a decent manner and things like that as well. Just going, what are your hours on the phone usually that they can call in to make an appointment?
They're there in the office from 9 to 5.
9 to 5. Are they there Monday through Saturday or Monday through
Well,
Friday?
actually, they can still call on a Monday, and we will answer the phones in Las Vegas. So if you call in on the Monday and we're not there, they can still schedule an appointment to see us Tuesday through the Saturday.
Tuesday to Saturday. So, I mean, just call during your lunch break, you're at work.
Yeah.
Make an appointment. If you need to make an appointment for Saturday, even they'll see you on a Saturday. That's phenomenal. Like, they can, I'm trying to get out on Friday night, you want to go get that date, and you're like, maybe I don't feel so well. See how it goes, I'll get an appointment for Saturday even if you need to.
Correct.
It's pretty awesome.
Yeah.
And their availability is pretty good. And just to reiterate where they're located, they're off of Calvada, just past the Calvada I, near Pahrump Valley Boulevard. It's hard to miss their sign. They're right next to LabCorp and things like that right there. Big sign up there. And their office is really nice and neat, like I mentioned before, and easy to see. And Troy's the main guy over there. Do you guys have any other nurses there or practitioners as well, or is it just you as the main go-to?
We have a medical assistant, excellent medical assistant. Her name is Rose. And if you call the front desk, you'll talk with Jasmine, who is great. She will fully take care of you. Yeah.
So we could call Rose, or call Jasmine. Rose will take care of you a little bit.
Yes.
And then Troy's going to be the one that's going to make sure you assess and get you the medications
Yes.
that you need and things like that.
Yes.
Now, I want to talk a little bit more about, you mentioned doing virtual visits at all too. That's been a conversation I think of all of our doctors we've interviewed here, is because virtual is becoming the biggest thing right now, especially since nobody wants to go out and get contracted any kind of coronavirus and things like that. Do you guys have specific technology you're using for the telemedicine, or are you guys trying to use platforms that are already in existence for clients and patients? What are you using for that?
Yeah, so there's kind of two ways. We have our electronic medical record system where people are used to looking at their own records online. They actually get a text the day of their appointment, and all they have to do is hit the hyperlink in their text when it's appointment time, and then it'll pull it up. Also, for the time being, Medicare, the federal government, has allowed us, all providers, not just us, all providers, to conduct telehealth visits by the telephone, by cell phone. And we have been seeing, and just like everybody else maybe you've interviewed, that a lot of patients, besides having concerns about coronavirus and getting out and about, they just are loving the convenience of talking to their doctor or their provider on the phone, driving down the road or at home. So,
I listened to a podcast called Freakonomics, and they're talking about the fact that they're finding that doctors are actually getting more information by the phone because you can see their family life, you can see what's going on behind them. It's more than just the patient, and you're able to find out even more underlying conditions maybe you wouldn't talk about in the doctor's office. Finding out, hey, wait a minute, you have a dog, or you have something, maybe you're allergic to that, or something that's coming on that they don't realize or get to see in the doctor's office, but you get to see it you get to see in home and stuff like that. And even if a flip phone, a lot of doctors' offices, some of them are only doing telemedicine via video chat. You guys are letting them actually talk and use the technology that's been around for over 100 years, 150 years, and actually talk on an actual phone. Even if a lot of people have flip phones now out here, and it's like you can call in and slowly get an appointment with a flip phone even. Yes. That's phenomenal. That's great. So it's not like you have that barrier to getting an appointment with you, or don't have an excuse not to see your primary care doctor anymore.
It's really interesting because, as you mentioned, the technology has been there for quite a while. And, unfortunately, we're having to go through coronavirus, but I think it's going to be revolutionary with respect to how we do a lot of parts of our business, including physicians' visits and stuff like that.
Yeah, so it just makes life a lot easier. And even us, I would say our practice too. You can see it virtually. We use Microsoft Teams, Zoom, whatever we can to get things going, be able to see you and talk to you. But it's the nice thing about nowadays too is we have masks, we have distancing, things like that. We try to keep everything clean, washed down, and try to make sure you're safe and everything like that as well, especially those populations that are at risk. And I know a lot of people, especially if you're an essential job worker, that's I think the biggest people that are right now are hurting the most. We have a lot of essential workers here in Pahrump. Maybe you work for work for Walmart, Smith's, or Home Depot, things like that, where you're open constantly. You're like, man, I'm working like a dog. I'm feeling like I'm getting worn out and sick and tired. Maybe I can't afford to see a doctor. I feel like it's a punishment for me. You can call Silver Say Health and get in to see them, right away, even on a Saturday. That's phenomenal.
Yeah.
I mean, who does Saturday visits? Come on. This is
Troy does.
Troy does. Yeah. Yeah, his wife doesn't like it too much, but but he gets Mondays off, so that's why. So you got to have the kids and wife there to keep them happy a little bit. But is there anything else I missed with you guys that you want to talk about before we close the show and episode?
Well, we've talked about a lot of mental health, but Troy, you want to talk about families and children and that?
Yeah, I mean, we see all ages, but one of the things I would like to talk about is, just when you do meet with me, if I'm going to prescribe something for you, cost is a big deal to everyone. So I will discuss, if there's a new medication you're going to be started on, I do discuss the cost of those with my patients, because that's important. I'm not a prescriber that just says, hey, this is what you're going to be on. I will discuss way ahead of time, usually the cost of your medication, because cost for any patient, whether you make $1 million a year or you make a penny a year, it will always be important to me to help make sure that we can take care of those needs.
Yeah, you'll pull up GoodRx with them. You were showing me the other day at the
yes,
office.
Exactly.
GoodRx is what it costs.
Yeah, this is what it'll
hey,
cost
here.
here.
$5, whatever. Those kind of things.
Yeah, I think that's important.
And you see families too, you say too. Like, what ages do you take for families?
Yeah, we usually from 2 years old and on is what we see there at the practice.
So even your kids and stuff, your whole family can see
Yes.
one practitioner. We should have talked about that more. Maybe our next interview we'll have to do that with you next time. But, but we're getting to an end. But I thank you for coming and tuning in today. I hope you enjoy it. Again, check out silverstatehealth.org, battlebornfinancial.com. We'll take care of you. Thanks so much. We'll see you next week.